Hopefully everyone can see my slides now. Go ahead and let me know in the chat if you can or can't see those slides. Obviously, I will do my best, like I said, to keep an eye on that chat to keep you all updated with and answer any questions that you might have. Joe's letting me know that we can see. Fabulous. Okay, well, it is 3 minutes past, so I think we should probably start cracking on with the webinar. We've got kind of up to about an hour in this morning. It's calendar for the webinar. Guys, I really don't think we're going to need that unless people have, I don't know, 12,000 questions for me. But like I said, make sure to drop those questions in the chat and we'll have some time, proper time for Q&A at the end. So I'm Josh. I'm one of the team members at Log My Care. Log My Care is an NHSX assured digital care management system. We work across all parts of the social care sector, but specifically in home care organisations. Hence why we partnered with the Home Care Association for this morning's webinar. And this morning we're going to focus on how to pick the right care management system for your organisations. And this is appropriate whether you've got a care management system in place, or if you are just picking your first one and transitioning from a paper system. Hopefully, a lot of these tips will help you assess different systems on the market and pick the right one for your organizations. We'll dive into what to consider when picking a system, what to avoid, and how to make a decision that actually empowers your team and enables them to deliver outstanding person-centered care. There are loads of reasons why you might need to switch systems if you've already got a digital system in place. But I think the thing to remember is that care is always evolving, not just in people's needs, but also in the things that a regulator, whether that be a CQC or a local council, want from you. And there's always a new pressure, whether that be costs, compliance, workforce. Everything is always changing in social care, and we always have to keep adapting. I think a lot of people that I speak to are often dealing with older, clunkier systems that are actually adding administration or adding frustration to their processes rather than removing those. And it's often important just to kind of think and ask yourself, is your current system holding you back rather than empowering you? The benefits of switching to a system, I mean, I'm sure everyone's been frustrated with something and felt some of these benefits, but whether you've got enhanced efficiency, removing the time wasted from admin, whether you can spot trends better from a new system, have stronger communication, whether that's sharing information from managers to team members or from managers and the service to family members, for instance, or other medical or health care professionals. And obviously, you want it to empower you to provide more person-centered care by enabling team members to actually have better insight into each person they're supporting. The first step is obviously to think about what your organization actually needs. And this is going to be incredibly unique to every single organization. It's really important to think about what tools you're already using. So do you have any tools in place? Any of them integrate with any care management systems on the market? Or did you buy a package from a single supplier? Where are the gaps? Are there any tools that you simply don't have that you feel like you'd like to take digital? I think one of the key things a lot of providers are looking when they've already got digital care records, for instance, is adding rotas or adding email. Think about what systems you don't already have available to you, and what does service users need from you? Do service users need more time with team members? Do they need better scheduling? Do they need more detailed care records because things are sometimes being missed? Thinking about how you can improve your administrative processes to enable you to enable you to better fulfill needs from your service users. And I think something that's always really missed in these decision-making processes is not including enough frontline team members, whether that be carers or senior carers or even, managers, for instance. The number of times where I've spoken to an owner or a director of a service who doesn't actually use a system day to day, but feels pretty confident making a decision on what system their teams will use is absolutely astounding. So please, for everyone's benefit, make sure you include some of those more frontline, more involved team members, because at the end of the day, they're the ones actually using the system. And I think it's important to set really clear goals as well from your transition. Once you start to look at all of the systems on the market, it's really easy to forget the reasons why you were looking and exactly those needs of your organization and think, well, oh, that's got a shiny X, Y, and Z. I think I'll go for that one. But it actually didn't do the core thing that you were hoping a system to do. And so really use specific needs for your organization and keep referring back to them as you look at different systems and start to compare. And I think there are four key mistakes when trying to purchase a system that I see more than anything else. I think rushing into a decision is really poor, and this always links to not actually getting input from your care team. It's really easy for one manager or one owner or director to see one system and think, yep, this looks good, and just buy. And they can go through this process super quickly and not actually ask or show people who are going to be using it more so day to day. I think the second one is getting locked into a rigid or long-term contract. Now, some people might want a long-term commitment to a system, and if that's what you're looking for, then definitely discuss that with the systems that you're looking at. But if you're not looking for a long-term commitment to a system, never feel pressured into getting locked into a long, rigid contract. I've spoken to providers with 3, 5, 8, or even 10-year contracts with some providers, and I think it leaves you incredibly vulnerable in the future to that provider not keeping up with the market or the requirements that you're looking for, and you almost get left behind in those cases. Number 3 is underestimating the actual amount of training or onboarding that needs from a system. It's super easy to watch someone who's familiar with a system, use it super easily and, make it seem easy. And you think, oh, how hard can this be? But it is, regardless of the system you choose on the market, going to take some time to get set up and running with a new system. And so it's really important not to underestimate those training and onboarding needs. And finally, my kind of mistake to avoid, I guess, or maybe a helpful tip here is to make sure to stress test and request case studies before committing. Whether that's getting those case studies, doing a trial, or speaking to a current customer of whatever system you're looking at, it's really important to get real and honest feedback from any system that you're using. And any company that is got faith in the system that they make should let you have all of those things. When I was trying to prepare for this webinar, I tried to think about the 5 most important things that I think is broadly applicable for services to look for across all of their care management softwares. And this is specific for home care in this case. I think usability is going to be number one. It's always top of what people are asking me for or wanting to discuss with me. Actually having a system that is typically accessible via a mobile device for team members when they're out on visits is really important. And it should be so simple that a new staff member with no or very minimal training can just pick up that mobile device and start to use the system. Any key features that you're looking for? So obviously most systems will cover your core care management needs, but if you're wanting things like medication tracking or scheduling or rotas, it's really important to ask all of those questions up front and clarify where they're coming from. Are you secretly purchasing a care planning and an email system and a rota system, or are they really one system and one app and one price for everything? Obviously, security and compliance is incredibly important, whether that be GDPR or other data security measures. It's really important to think where your information is being stored and what things are in place to protect and maintain that data and information. Obviously, customizability and scalability is really important. So can this system support you to grow, and can it be flexed or customized to suit your service? And finally, how much support are you going to get with that onboarding and training? Because it's really easy to underestimate, like we were saying, the amount of time or energy it's going to take. And so it's important to understand who's going to be walking you through all that onboarding and training, and how much onboarding and training do you get, and how much ongoing support do you get, and what are the channels for that support. I think I'd love to throw in just a quick case study from a Log My Care current customer who moved from paper to Log My Care, highlighting some of those things, specifically how intuitive some systems can be on the market. We can see that the difference between recording just a few logs to almost 170 logs per week, and the amount of information that you are recording and enabling to have in the future, and making sure that things are not delayed. A system should be so easy that it should be able to be used at the point of care by team members, rather than them having to, at the end of their shift or at the end of each visit or the end of each day, dump all of that information to the system, and you essentially don't actually get the real-time updates that you're hoping for from a system. Now, obviously, we know in social care, no one is flush with cash. And so whenever you're thinking about spending money on a digital system or for anything really, it's often important to think about how that can provide cost savings as well to your organization. And one of the kind of key ways that we think systems like yours can save you money, as we've got a poll coming up on the system now. So go ahead and let us know what concerns you most about switching. There are a few options there. It'd be great to get some feedback there from you. But obviously, cost is definitely going to be one of those things. But we think with any system, and Log My Care specifically, we would hope that you can actually streamline how you're making your notes and remove admin time, and either give that back to service users, providing better care, or in terms of costs, reduce staff costings for the organization, and use existing staff more efficiently. Obviously, if you can consolidate into a single system, so like we were saying earlier, rather than buying a care management, a rota system, and an email system, if you can combine all of those, you've got lower training costs, less admin burden, no more duplicating information, and that obviously saves time. And then predictable pricing is really important. You don't want a system that's going to be fluctuating all the time with how much you're using it, having consistent, stable, predictable pricing is going to enable you to budget and plan for the future. And a quick shout out to a Care Through the Millennium, who we helped save around £6,000 per year by switching to LogMyCare. Obviously, I've spoken quite a bit about LogMyCare and about what we do, but I'd love to spend a little bit of time and just show you a little bit about how the system works. So what we will do is I will go ahead and stop sharing my laptop screen, and we'll go ahead and start by having a look at our mobile app. At LogMyCare, we call this the Carer app. So like we were saying earlier, the ability for individual team members to log in via a mobile device, whether that be something like a phone or tablet, and be able to check their rota, record care, and so on from their mobile device. And like we were saying, the most important things that we are looking at, especially on this mobile device, where the carers are going to be using, is how easy and intuitive it is to use. We should be able to just give this app to any of our carers, and they should be able to get on with it pretty easily. For LogMyCare specifically, every team member is going to get a separate account with a 4-digit PIN. So I can go ahead and log in to my account. And we'll walk through this as if I was a carer. So we can see my rota at the top, my 30-minute call this morning with one of our supported people, Charlie. I can read more information about any of these calls, make sure I'm going to the right place, and clock in and clock out through the app. And for any of those managers out there, you know how important it is to be able to track hours, to be able to pay. And that's how we're going to do that using our clock in and clock out. I can obviously see a few tasks for Charlie, but if I didn't want to be ticking off any of those specific tasks, I can come and record an item of care for Charlie straight from the homepage. And let's say I was helping Charlie with some personal care this morning. Obviously, this was a morning visit. So let's say we got Charlie out of bed and then helped give him helped him get washed, for instance. I can just click get washed, and for each question or for each item of care, we're going to ask that carer some specific questions. Carers don't have to remember what to write down. They don't have to add extra amounts of detail. They just have to tap, tap, tap for each one of these recordings. So for example, helping Charlie get washed, let's say we help Charlie have a bath. Obviously Charlie consented and he needed some assistance. And then we can add some more comments, add a photo or a video, flag it for handover, and add a witness if it's a 2-to-1 visit, for instance. And it is as simple as then just clicking save and saving that log. And that immediately gets published to what we call the Care Office. That's a desktop version of the system for managers and administrators to be looking at real-time information. And we'll come on to what that looks like in just a minute. Obviously, we've recorded an item of personal care for Charlie, but let's imagine something's gone wrong on this visit. We helped him bath, but something went wrong. We can obviously use the mobile app to record an incident as well, something like a fall. Maybe Charlie slipped getting out the bath. For an incident, we obviously have to confirm what time the incident occurred. Let's go ahead and say it was 11 o'clock. And we need to detail what actually happened at the incident. I could type this, or I can use my phone's voice dictation here as well, which I'm going to do so you can all listen to me. Charlie slipped and tripped when getting out the bath and hit his knee on the side of the bath. Go ahead and stop that. And we obviously want to record what follow-up actions we're taking. So I'm submitting an incident report and I've notified my manager. And go ahead and press next. We can see it's automatically flagged for a handover, and we've got those same options instead of adding a comment, adding photo or video, and so on. And again, we can go ahead and save that. And specifically for incidents, Managers and admins in the care office are going to get a notification that that incident has just been recorded. So if they need to chase anything up and action anything from their side, they're going to be able to do that immediately from the care office. So we take a lot of the burden of communication out of that as well. Obviously, if we're on our visit this morning with Charlie, we might want to check something about his care. Can flick over to my clients and go and have a look at Charlie's profile. Within Charlie's profile, we obviously have all of those logs where we can see a fall that I just recorded and that getting washed I just recorded. And we can see a shopping trip and a photo and a video attached from my colleague. And we can go back and see all of the previous logs from the service. So whether that's an activity, any medications recorded, another fall, and so on, and any daily summaries. Within each person's profile, you've got access to their body maps, charts, and then the extra care related information. And we get immediate access to complete copies of any of their care plans and risk assessments. I can simply click into Charlie's care plans, and these are broken down by subheadings. So if I need to check something specific, whether that be how he accesses the community or any of his continence needs, I have specific signposts to them rather than just scrolling through 14 or 15 pages of information. I can just select exact information that I need to look at. We can also see that a lot of these plans are bolded and they've got a little red dot over the icon. That's to let myself as a carer in this case know that there has been an update since the previous time I read that. I can go ahead, click into a care plan, read all about Charlie's strengths, his needs, any of those associated conditions, and we've got risk assessments embedded within each care plan. But we always make sure to surface any of those actions to mitigate the risk. Although I can just click through and read the entire risk assessment straight from the care plan. When I feel like I've read this plan, I can go ahead and mark it as read. And we can see my little face, same t-shirt, funnily enough, has appeared just there. And when we go back to our list, we've removed that bold and that little red dot. Obviously, we had a little look at some of those risk assessments, but we also provide carers a complete list of risk assessments as well. So again, we don't have to go searching for any information. I can immediately go ahead and again, look at that communication risk assessment and read the entire risk assessment. Again, without having to go searching for any specific information. If I needed to do medication with Charlie on my morning visit, I can immediately access any of his medication. And something really important to check is whether a system supports both scheduled and non-scheduled or PRN medication, which is something luckily Log My Care does do. I can go ahead and sign for Charlie's 9 a.m. round, select which medications I'm administering. And if we're not administering a medication, we obviously have to give a reason why we're not giving that. And adjust stock count if we're managing this person's stock. We can review that medication round and then go ahead and sign that medication round. And the same for non-scheduled medication, where we can see Charlie's 2 PRN medications, select PRN medication to sign, review that PRN medication, and go ahead and sign the email chart. And we can see immediately it's updated that email chart, letting us know when that was most recently taken, and that will also appear for the next person coming to visit Charlie, so there's no problems in terms of communication between staff members and between visits as well. Lastly, I would obviously want to be clocking out of my rota to say that I've clocked out of my visit with Charlie, where I can add any additional notes, and any clock-ins and clock-outs will be both timestamped and GPS located within Log My Care. Once I've finished this morning's visit with Charlie, I probably want to go and have a look at the rest of my rota and see any upcoming visits that I have with any of the people that I support. Where again, we can see all of those key details about each visit. That's obviously what the system looks like from an individual carer's point of view. I'm sure that we'll have some managers in the call who are really keen to see what they're going to see and how they're going to get real-time notifications to manage their service rather than just hearing about things almost secondhand. Well, hopefully you can all see my laptop screen now where we're having a little look at what we call the Care Office. This is the management portal for the Log My Care system, and this provides those real-time insights that we're looking for the service. Obviously, we've got a list of our clients and any team members who have been active recently. We make sure to show you any incidents and alerts right up front. We can obviously click through and read more about any of those incidents. For example, that fall that I recorded earlier, and we can see a different incident that was also just recorded by my colleague, Richard. We give an overview of any tasks. These are our to-do, so similar to those daily logs that we looked at, except these can be scheduled for team members. I can immediately see which to-dos have been completed. Unfortunately, my service is being very bad this morning. We haven't completed any, and we can see any overdue tasks here. Read more information around them and the person that was supposed to be supported to do them, or the team member that was supposed to action any of those. And obviously, we can then go ahead and chase up all of those missed tasks. We've got a quick overview of our rota where we can see any key notifications, such as overdue or cancelled or in progress or completed. And we'll have a little look at that complete monitor dashboard in just a second. You obviously want to make sure that you're being supported to have oversight of your service, especially some of those care plans, support plans, for instance. So it's really important to be able to see when plans are coming up or overdue for review, and have an insight into medications when things have been missed or signed for. We'll have a little look at reviewing a client's care plan, and then the rotas, and then the reports. I can simply come to Charlie's profile, flick down to those care plans, and we'll have a little look at that community learning and leisure plan that we looked at on the mobile device as well. We can again read any information from this, and in this press of a single button, we can go ahead and update the plan where we can change any outcomes, adjust those strengths, add any needs or remove them, adjust the risk assessments by adding a new one or removing one that no longer makes sense to be linked. When we feel like we are up to date, obviously adding any more documents, for instance, we can go ahead and add a comment on this review. So obviously I haven't changed anything, so just go ahead and say no major changes on this review. And for Log My Care, you have to set a review date. So whether it's a custom date or a preset, or saying no support in the future is required, we have to make sure that we are making sure that we're recording when those plans need to be updated in the future. I'll just go ahead and select 3 months and press save. And we can see we've immediately updated that next review date. And we come back up to the top, we've got that last review date along with who reviewed it and the review comment that we just stored. And we can either download this plan individually or see historic versions of plans as well. So if I want to go and remind myself what were Charlie's needs like 3 years ago, we have access. We have access to any of those historic plans as well. We can see what my colleagues added and removed to each of these. Obviously, rota planning for home care organisations is a massive pain point and a time-consuming thing. And so it's really important to make sure that you have a system that is going to be intuitive and straightforward. Whether we're allocating by team member or by client, it's important to be able to just, in a single click of a button, select team members and allocate them to visits and be able to publish any events in a single press. And again, be able to drag and drop by team member. So obviously I can see my colleague Amy has morning visits with Charlie every day, but she probably needs something a little bit later on. I can immediately just drag a later visit down, for instance. So something like this one with James, and publish. And then Amy is going to get a notification that we've added her to that visit. You obviously want to have day-to-day oversight of your rota as well, where we can see any overdue shifts. So we can see no one's checking in for their shift in my service this morning. We can see no one currently clocked in. And we can see that my colleague Richard, for instance, missed clocking into his shift with James this morning. And I can immediately give both Richard and James a phone call to check what happened with Richard and let James know if another staff member is coming now or if they'll come next on their next visit, for instance. And we can track any absences, whether those be planned or unplanned absences, directly from the app. The last thing we'll have a look at is the reporting side. Obviously, whenever we're preparing for an inspection or just trying to audit and manage the service, having access to easy reporting tools is going to make managers' lives so much easier, save them so much time. They're not digging through reports to find things. They are instead getting up-to-date information in a touch of a single button and then spending more time actually actioning and improving the service. On our incident dashboard, we can see cases surrounding incidents, and we can break incidents down over time, both by location, by incident type, and by the severity of each incident. Or alternatively, you can break incidents down on a month-by-month basis, filter for specific types of incidents. So something like those falls, for instance, or break it down as a stack chart and start to spot trends month on month. You should always make sure that you have access to any basic reports you'd need, whether that be fluids, foods, activities, mood, temperatures, wash, and so on, or have the ability to create custom reports as well and filter for specific things, whether that be clients, staff members, categories, or items, and be able to build your own reports in the system if needed. As we discussed on the homepage, you want to be able to see when care plans or risk assessments are due for review. And we can see here any care plans that are overdue for review, any due for review today, and due for review within the next 7 weeks. And it's important to have really specific information about your medications, whether that be any missed medications or medications that were signed for but not given. So we can see the refusal code there for the pregabalin we did on the mobile device. Log My Care also manages stock, so we can see any low or no stock notifications and any stock discrepancies between a expected and a manual stock count. And lastly, it's really important to think about how you're going to get your information out of the system, whether you're planning to leave a supplier or just be able to send it to a local authority, a CQC, or just put it in a spreadsheet for your own benefits. I think one of the really nice things about Log My Care is we try and make that process incredibly easy. Rather than having to ask a member of the Log My Care team, you can get immediate access to all of your information through our download center. You don't have to ask us. You can just immediately come to the download center, and let's say the local authority was asking for all the care that we provided, let's say last month, for Charlie again. So they wanted all of it, but we could obviously filter by category or by item and download that in the single touch of a button, and then just drop that file in an email and send that off to them, rather than having to flick through loads of paper files or kind of screenshot or ask our current supplier, if you're not using LogMyCare, how to download that information. So it's really important. It's great that the information is in the system, but it's also really important to consider how we're getting the information out of that system and how we can make that as easy as possible. Guys, that was a pretty whistle-stop tour of LogMyCare and how we answer a few specific things that we were looking for in our main points of how to pick a system. Finally, we will have a little look at my last slide, which I seem to have lost. So please all just bear with me as I find my slides again. There we go. Obviously, if you're thinking about getting started and looking at some options of care management systems on the market, we would recommend exploring multiple options, and we'd love LogMyCare to be one of the options that you explored. We mentioned stress testing that system, whether that's the demo or the trial account or talking to current customers or case studies. Make sure to stress test anything a company is telling you. Make sure to determine how it meets your needs and make sure you're really firm about what your services needs are. Request those case studies, and just a little thought, make sure to ask about any future plans that they have and any upcoming changes or adjustments to the system. This will give you a really good understanding of how much they're going to continue to develop their system and what more benefits you could get in the future. Thank you all so much for listening to me. Like I said, drone on for 40 odd minutes. I would love to answer any questions. I've got the chat open. Let me go ahead and just stop sharing my slides so I can make sure to see that chat. I've got the chat open. I understand maybe no one has any questions, and that's fabulous. But if you do have any questions either about picking a care management system or about LogMyCare specifically, I would love to field any questions from anyone in the chat. I will sit around for a little while just to make sure that anyone has their questions answered. Obviously, if you don't have any questions, thank you so much for attending the webinar. It's been a pleasure to talk to you all this morning. Make sure to look after yourselves in the heat. Today it's going to get pretty extreme, so I'm thinking water and fans. And any questions about either LogMyCare or picking a care management system in the chat. Any questions? It certainly does not look like there are any questions unless I am missing any. I do not think I was actually in the wrong chat, so that's absolutely fine. I do not believe I am missing any, but please drop them in the chat right now. Otherwise, I think that brings our webinar this morning to an end. So thank you all so much for listening to me this morning. I hope you enjoyed and learned something when looking at changing care management system. We'll reach out to anyone who said they were keen to learn more about LogMyCare, but you can also get in touch with us on our website. That's just logmycare.co.uk.